This is the Aware Families Podcast, the show that brings you a science-based, practical look at how to use the principles of functional medicine to keep your family healthy. All right, welcome back to this episode of the Aware Families Podcast. I'm one of your hosts, Tom Flass.
And I'm Brittany Coburn, and we have a guest with us today, Tyler Ladenburg. So grateful to have you here with us.
Thank you. Excited to be here.
Yeah. Hey, can you tell us a little bit about yourself? So you are a physical therapist with one of the largest physical therapy companies here in the Valley, and maybe Montana. I'm not sure, because every time I look, you're opening a new site. Tell us a little bit about like your background and all of that good stuff so we can figure out why it was so important that we brought you on our show.
For sure. Thank you. Thank you. This is fun. My name is Tyler Ladenburg, and I am a physical therapist with OrthoRehab Physical Therapy. We are founded in Kalispell in the 1986.
Wow.
So it started as one location with Keith Ory, kind of one of the originals of PT in the state. Those professions were relatively young in the state. But since that time, we've grown to 12 locations across the state. About 40 providers. Ish, 35, 40 providers.
So was I right that you're one of the largest?
I think we are.
Are the largest. Yeah. Okay, because I'm like, I don't know anybody larger than your group, but
there's there's some other groups that are in the ballpark. Okay. But nobody, so we're in primarily Western Montana, located in the Valley. We have 5 locations in the Flathead Valley, 2 in Kalispell. We've got Big Fork, Columbia Falls, Whitefish. We've got 3 locations in Lincoln County. Dillon, East Helena, Townsend, and Great Falls.
Great Falls, yes.
So yeah, we have multiple locations around the state, and always looking to grow. So yeah, that's what we do. And I'm a physical therapist by training. I'm what we call a clinic director. I run the Columbia Falls location with a lot of help. Yeah. And co-owner of the group.
Awesome. Yeah, that I know those. All of the different locations have always been so accommodating for us when we refer, and it's really nice because if we, write for something and you guys are like, hey, this particular issue may be better served by this other location, right?
Mm-hmm. Or other provider
like in your system. It's so easy to just kind of transfer.
And that's always been our motto, is that we want to treat people where they are. Yeah. Try to get close, make our care accessible. Yeah. And part of that is location.
Yep.
Do you sort of have like a subspecialty or area? Well, what areas do you tend to focus on? Or, usually people have their favorites and things like that. So.
Without a doubt. So myself personally, I am a I would call myself a meat and potatoes physical therapist. I mean, I'm in a small town. I've practiced out of Columbia Falls for the last 15 years. Mm-hmm. So when you're in a town the size of what most of our locations are, there's a tendency away from like the true specialization of some of the bigger towns. We have specialists, of course, but I personally, you start out thinking it's one thing. I doing the sports medicine and the post-op stuff, and that over time I've gravitated towards more spine, more low back, more headaches, neck pain, difficult diagnoses, people that have tried a couple other therapists, that kind of thing.
You go where the need is.
Yeah, you go where the need is. And that actually is one of the things that makes it evergreen to me, is that you're not seeing, I think if I saw nothing but ACL recovery, 10, 12 cases a day, 5 days a week, that would be less fulfilling than getting a chance to see multiple different types of cases, and it's more about the person themselves. And so that's been good. But I think at this point in my career, I would lean towards spine pain, headaches, neck pain, those sort of things.
Which is not rare.
Not rare, right? Speaking from all of us here.
Yeah, exactly.
We're like, I don't know, maybe we yeah.
Right.
But I know you mentioned a few back in there a little bit that, difficult cases have been something you've also enjoyed, because I know I've sent you a couple where we've kind of been like, I don't really know, it doesn't medically make sense what's happening, and then, sent them over to you and I know that at least the last couple are feeling a lot better.
Yeah.
But you have to kind of dive in deep, and really think outside your box, probably.
Probably, and I think that that's one of the fun parts about physical therapy too, is that it's therapy. So the therapy part of it is implies that they're going to be an active part of what they've got going on. And a lot of what we do with difficult cases is say, okay, this is where we're going to start, and just making sure they understand that I'm not going to do something to you that makes you necessarily feel better or worse. I'm going to tell you some things to try. You're going to go do these things. You're going to come back. It's just as important that you come back and say, hey, that didn't work at all.
Right.
As it is that you come back and say, wow, thank you so much. I mean, that happens. You do get a couple people that they one and done, so to speak.
But sounds rare. In line with functional medicine.
That's what I was just going to say. I'm like, you're speaking our language, right? Because that's, people who come here have been in the same position where it's like, okay, we're going to try some things, and yes, we need feedback. We need to know, what's working, what's not. Does this make you feel better? Does this not? And then, we do a lot of diagnostic testing, but you are doing it too with manual.
Yeah, I was going to say, like, you're as much a diagnostician, as a therapist. I mean, it's part of being the therapist, though. It's also, you have a whole separate toolbox of diagnostics of, like, what's actually going on that, we don't have, and most medical providers don't have. You're like, knee hurts or whatever. It's like, well, it could be something. It could be your hip, could be your ankle, could be whatever. And then, that diagnostic skill set that you have to be able to parse out, like, what's actually, again, root cause, right? Like we talked about this before we started recording, that there's the root cause part of it is a huge part of physical therapy. And, a lot of medicine is more symptom based, but I think it's so in line with functional medicine because we were talking about that upstream stuff that you do. Yeah,
thank you for saying that. And I do think physical therapy and functional medicine go hand in hand. And the diagnostic component of what a physical therapist does, I think that's the skill set that you learn as you go. And you get a little keener eye. I'm sure that in every profession. You get a little better. But the diagnostic component of what we do is what separates, I think, a physical therapist from, what some people think physical therapy is. I think that the fact that there is an actual diagnostic component of it is what makes it worth it, so to speak.
Yeah. Maybe we should clarify that too, because we were talking about that too. I think there's and being a kind of standard trained medical provider, I sort of had this, thing in my head of physical therapy is like, oh, you get an injury, you go to physical therapy, but it's so much more than that. So, like, what's the perception versus what does it actually encompass, and your view of it? I think that differentiation would be good.
Yeah. Like, what do you think people think of physical therapy versus what it really is?
Okay. Yeah, that's a big topic, right? Like, there's a lot going on in that one. I think that really commonly people are going to think about physical therapy as post-operative care, post-injury care.
Right. So surgery. So meaning, so somebody has surgery and then they're not doing well and they need to go and get it, like, rehabbed.
Right.
Okay.
Or trying to avoid surgery, but they've already done the injury. And the damage is done.
And even that is somewhat new, right? Even that like component of what you're saying is like a preventative prehab sort of thing.
Totally.
Yeah.
That whole component is somewhat new. I think historically people are saying post-operative rehab.
Knife first, therapy second.
Us.
Yes.
Sorry.
But I was just going to say, what we should be doing is post-labor. So when you're pregnant, or not post-labor, pre-labor. So you can do PT so that you're strong enough to deal with labor and then the recovery after labor. Like, that should be a part of every pregnancy. I am not even joking. You just mentioned with the surgery, and I'm like, oh my gosh, every single pregnancy you should do PT to, like, strengthen what you need to do.
Which goes into the whole rise of pelvic PT, which is a whole separate topic.
Yeah, we'll get there, right?
Yeah.
But I think that physical therapy as a profession, if they had a mission statement of what we do, we're movement specialists. So there's a lot of different ways to just take that. That's a very loaded phrase in and of itself. I mean, movement specialist, because there's a lot of ways to move, and there's,
as a GI, that means a whole separate thing. Maybe we won't go down that road.
Right.
I'm a movement specialist of a different type, but
like, we'll talk about Ashley Wentz, our pelvic floor therapist on the south end of town, and she works fecal incontinence. She works.
I refer all the time.
Yeah, she does a lot of stuff, and that's the pelvic floor component of physical therapy. There's there's not a ton of them that want to go down that particular part of pelvic floor. Like a lot of them are going to lean towards pre and postpartum, urinary stuff, and sexual pain, all that kind of stuff. And then, so to get somebody like Ashley that's really pushing the fecal component of it, she's been a godsend to just the valley.
Yes.
And dudes with prostate issues, you know, that what they call non-bacterial prostatitis that they're finding out is like pelvic floor dysfunction, a huge component of it. So, you know, I think, you know, and a guy would be loath to go to pelvic PT, but actually they're the ones that do, like, oh my God, you know, can make a huge difference for guys with prostate issues.
Huge. And it's a out of the way location. It's a very quiet clinic. It's so if anybody that did happen to get referred down there to her, I think they would be really pleased with their outcomes. But we do movement specialists. I think we go headaches to plantar fasciitis. I mean, it truly is head to toe. We have neurologic specialists. We have
so concussion, right?
Yeah, concussion.
Somebody has a concussion. You do a whole lot of rehab on helping people get back to baseline, because those buggers can last like 6 months. I mean, it can be a long process.
Particularly if you try to go on it on your own. And I would not purport to be a concussion specialist myself. Although
but you have specialists there.
But I do happen to work rubbing elbows with one of the only neurologic certified specialists in the state of Montana. I think there's 3 practicing in the state, and one of them is in Columbia Falls. And she's her name's Haley, and
she's been a rock star for us.
She's a phenomenal therapist. She does, again, she has a clinical specialization accredited nationally in neurologic, so strokes, traumatic brain injuries, Parkinson's, multiple sclerosis, wheelchair fittings, custom seating fittings, AFO fittings, assistive devices fittings, but also concussion, and that's the one that's near and dear to our hearts that we're talking about right now. She'll take somebody who might have a 6-month recovery, and they're going to play whatever their sport is in 6 days. That might be fast, could be a few weeks. And it really, that's one of those real dependent ones. But spine pain, elbow pain, we have hand specialists, we have orthopedic clinical specialists, we have the post-op, we have the pre-op, we have lymphedema specialists. We have durable medical equipment helping people with bracing and stuff. So it just goes. It's very broad.
Yes,
and that's
huge,
the thing that
broad.
I guess that's maybe just to kind of put a bow on that. Like if I was to say, what do I think that people don't understand about physical therapy is how primary care it should be. And how much we can do, as opposed to they think they're going to one of 2 routes. They think of us more as personal trainer. Or the other end of the spectrum, they think of us as massage therapists. And so you get those 2 kind of ends of what people, this is the general public, views us as. And it's neither. So, anyways.
And talk a little bit more. We were talking again before we hit record, like that kind of that PT checkup, the annual kind of thing that we were talking about, because I think people would be super interested in that, because that's a totally different concept.
And mind-blowing in a good way.
Yeah, I think that it's... Again, this is something that I get really, you try to make your service accessible, right? And like, you want to like get it in front of people. So that, I load the answer with that, because insurance generally isn't going to cover an annual physical therapy, physical, so to speak, or a checkup. But you think about how much you can save over the long term. To 80% of America will get, 80% of the world will get an acute bout of low back pain at some point in their life, period. Hard stop.
And chronic is not a small percentage.
Right. I mean, but they're going to get a debilitating amount of low back pain at some point in their life. You know, X amount of that is going to resolve spontaneously. But can we prevent that? Can we prevent the prednisone prescription? Can we prevent the unnecessary MRI?
Well, and the missed work.
Yep.
The missed time with kids, with family, with travel.
Loss of quality of life.
Yes.
Right. So you come in, you see a physical therapist, you got and a full hour check head to toe, customized home exercise program. We'll give you the exercises in our particular case. I don't want to speak for physical therapy as a profession, but we're all leaning in the same direction. You're going to get app-based exercises specific to you. You're not filtering through your Instagram algorithm,
trying to figure out what fits,
and basing who you believe on their exercises based on, I mean, oftentimes how they look, or like, you know, they have a good video editor or something like that.
Basically, you're going back to personalized medicine, which is what we do.
Personalized care. And that's what physical therapy, I mean, and don't get me wrong, there is overlap, right? And so when people come in and it's like, oh, I mean, I can't tell you how many times people are like, well, I do this next. And it's like, well, no, that's not how this works. Like, we're going to do this. We're going to do this.
Because just like anything, there's many routes to low back pain.
Right.
You know, there's it could be a whole host of things. Or your hammies are tight, or, you know, you're not lifting, whatever it is. But that's what you guys do, is figure out, like, why is this happening? Go upstream. Rather than just like, oh, we're just going to do some cortisone injections or something like that.
100%. And if we can get a good relationship with, because it isn't in a bubble, right? Like medical practice or medical care for somebody should be comprehensive. And so if you can get referring providers, although we are a direct access state, people can come directly into physical therapists. But if we can get referring providers to communicate with us cleanly and well, we can talk about, hey, this is what I see here. This is what I see here. What do you see there? Do we want to get whatever screen it might be, whatever imaging it might be, if we are up against something? Because I think one thing that a lot of PTs one thing I would caution PTs or any profession against is don't think you're the end all be all. Like, there is a time to punt. So
well, it's a team, right? It's a team approach.
Yeah. And that's how we view everything, right? Like dietary, movement, counseling, therapy. I mean, it's just we're one whole unit, but we're made of a lot of components.
Right.
And we want to move our bodies. You know, one of the things people will talk to me about when they come in, and we're talking about health span versus lifespan, right? And how do we get those to match? And it's like, what is important to you? What is a value? Like, why are you here? What is it that you want? And they're like, I want to be able and moving around and not stuck in a chair when I'm, you know, so old. Well, movement is a huge piece of that, right?
Yeah, I think it's...
I have a 92-year-old who's getting home PT right now so that she can stay strong enough so that she can get up and down.
Yeah.
Beauty. Love
I mean, so they're doing home PT for, like, this just strength-based, like, what does she need to be meeting her goals?
Oh, without a doubt.
It's lovely.
It's independence, right? I mean, movement at the end of the day is your independence. And so if you can't move, that's what falls, risk of falls, those sorts of things, that's what gets you committed, so to speak. It gets you out of your home where you don't get to be independent anymore. And so you talk about health span, marginal decades, you know, those sorts of things where trying to get the glider as high as you can, because it is inevitably going to plateau out. And if you do stay active, that plateau can stay a plateau
longer,
as opposed to
and identify deficits and weak points before things get real gnarly.
Because athletic people are harder to evaluate than non-athletic people or less athletic people, because they'll compensate for things.
Right. And all of a sudden they're coming in and they have a whole nother issue because they've been compensating for the original issue.
That's usually what you got, right? You know, I've got this flared up back pain, and you're like, well, okay, but like you mentioned, tight hamstring, tight hip flexors, weak hip flexors, strong over, blah, blah, blah. So that's why it's really nice when we get the back pain diagnosis, because doesn't tie our hands to whatever it's a disc. Well, it's not, or it's a hamstring strain. That's radiating back pain. That's something.
Right.
Those sort of things.
And then you're assessing like their core, their, like you said, their flexibility. Are they imbalanced in like muscle groups where one part is covering and the other part is really weak, and then pulling them out of alignment, like all these things, like I wouldn't be able to assess, but physical therapist.
But that's an interesting thing you just said too, because when providers do make a referral and it does go through insurance and they put a diagnostic code on there, right? And so they're saying right hip pain. Then you guys, to bill that person's insurance, right, are assessing right hip pain, right? And so if the patient were to maybe say, hey, this is where my pain is, when they're in their original appointment, but it's also more than that, they can have more added to their referral, correct? For you guys, and then you can have a little bit of a broader
expand the codes.
Expand the codes, generic, make them real generic. this pain, that
Yeah.
pain, hip pain and back pain, et cetera, et cetera.
Yeah.
It frees people up. I mean,
Yeah.
insurances are doing, some are doing better, some are doing
Yeah.
worse as far as what they allow, what they don't allow. You get, I mean, frankly, you get the more governmental payers have a tendency to, this is what was said, this
Right.
is what we will cover.
Yeah.
And we do, I mean, OrthoRehab does take effectively all insurances. There are a couple that we don't, but for the most part, we take insurance, we take cash-based, we are direct
HSA,
access.
FSA.
Yep, all
Yep.
of that stuff. And the reason being is exactly when we're talking about number of locations, you're trying to make it very accessible. And so
Yeah.
that becomes part of it. We bill insurance. So there's cash-based practices. That's going to become a bigger thing.
You're in one.
We're yeah, right. We're in a cash-based practice. You know, for
Here. Yeah.
physical therapy, there's still, and there are some here as well. When you're a company that happens to have the volume that we do, it's still, we're not there yet.
Yeah,
For sure.
I know.
size of
It's as the whole healthcare system kind of evolves or whatever you want to call it. It's morphing and they're more cash paced or going through the reimbursement model where then that person, like how we do it, if they have insurance outside Medicaid, Medicare, submitting that super bill. You know, I
Right.
know a lot of therapy and I'm sure there's patients that you treat that do that kind of thing that like won't be immediately covered, but they'll submit that super bill thing and in order to try to get reimbursement.
Yeah, it's getting bad. I mean, yes, that happens all the time.
Yeah.
And that's, we do everything in our power to make it as accessible as possible.
Right.
So,
Yeah.
but yeah, that's, like, I mean, put a bow on that. There's so many things that are this, but causing that, et cetera. So that's what keeps it exciting. For me anyways, is the puzzle of it all. If it was simply stretching hamstrings, I don't know that I could have done that for 15 years.
Yeah.
But,
Right.
you know, but the diagnostic part is definitely the joy of it and the fun of it. I mean, besides just the people and hearing the stories.
Oh,
like,
yeah. Well, yeah, because you get to chat a lot, right? So you probably hear a lot of
it's great.
people's life and get to really know them and have that relationship with people. And
I
love that part.
That really is,
Yeah.
that truly is the best part.
Yeah.
Is you get to know everybody.
Yeah.
I mean, we're in, even Kalispell,
Yeah.
all these, they're all small towns. That's Montana, right?
Right.
We're this giant small town
Yes.
with long roads.
yeah.
Getting to know people personally, and I'm from here, and still I
Yeah.
know so much more about so many more people, and it's just it's an enjoyable profession. I've made this joke a lot of times. We take students and stuff. If you,
You do, yeah.
can't be liked as a physical therapist, you just like, we are just by where we're sitting in the medical system. It's hard not to be the good guy. It's hard.
Right.
We're barbers. We're bartenders. We're
Yeah.
so it's fun.
That's awesome.
Although you probably cause a little bit of pain as part of the healing process, but that's part of the deal. Right?
Yeah, but if they're talking about their dog,
yeah,
Right?
you
It's
can
like-
sneak it in.
yeah,
Yep,
and then you're
right?
stretching that hamstring or whatever
Yeah.
it is, like moving with that way that they aren't able to move, but it's
Yeah.
it's all part of the learning process.
Putting a needle in their back while they're looking
Right.
away and telling you about their dog.
Yeah.
Oh yeah, the dry needling.
Yes.
I had that done, and that was an interesting experience.
It'll grab
Yeah.
your attention.
Yeah.
Yeah. I have not yet done that. I have, I think we've all done PT at some point, right? For something, or at least I would assume most people have. But yeah, it
Well,
helped me. I
It
know.
does, and that actually might be the last little thing, or one of the last things I do think about with PT that
Yeah.
people don't know is how many people would benefit from it. This is one of the things I was looking at on
Yes.
my listening to some stuff,
Yeah.
kind of prepping for this
Yeah.
morning. Is the old study that I looked at about 5 years ago was 80% of
Okay.
people that need
Of just people,
Of
all
just-
people, for any reason.
Walking around.
Okay, walking around.
80% of folks walking
Yeah.
around that would benefit from physical therapy never go
Oh,
at all.
yeah.
And 65% of the people that actually, and I mean, when I say never go, they didn't even get referred.
Right.
They got a prednisone prescription, or
Yes.
they got a muscle relaxer.
Truly manage suffering
Yeah.
versus healing.
Right. Yeah. 65% in the newer study, 65% of people that got the prescription for therapy, hey, you should go to physical
Yeah.
therapy, either didn't go
Right.
or cut it short.
Ah, okay.
Or didn't do their extra, whatever the case may be,
Right.
underutilized.
Yeah, the passive versus active engagement in their own healing process, which
didn't understand the therapy component of it as opposed to the do something to me component.
Yeah.
Right.
And so
it can take time too, right? And so maybe that you hit that on the head where you said they cut it short. So healing,
it's not one and done.
Yeah, healing is a tough one because it doesn't just happen overnight. We talk about this all the time here. Like, this is a process. I usually will tell people, how long have you had these symptoms before you came and found me? Mm-hmm. Right? Like, I'm not going to fix it in one time. Like, it's going to take us a while to get through this.
Yep, course adjust.
Yeah.
And without a doubt, every single day, it'll happen to me today, it'll happen to me tomorrow. Mm-hmm. I will have somebody look at me with their eyebrow raised saying, I have to do these forever? Yeah. I think you don't have to do anything, but I think it would help you a lot to do.
Right.
We're all guilty of it, though. I'm
for
like,
sure.
My neck was ginked, went to physical therapy, got some dry needling, the exercises helped, I did it for a while, and then you sort of fade off, and you're like, we all become our own worst enemies.
My husband right now with his shoulder, he's like, oh, what were those exercises? And I'm like, I don't know.
Time for a reboot. Right. You go back and you reboot.
Like, you're going to have to call Tyler.
Yeah.
And you do it. And frankly, everybody's guilty of it, and physical therapists are guilty of not.
Okay. Just checking we're good. Just checking to make sure we have enough battery.
Okay.
We're good.
Physical therapists are guilty of, I think, and this is one PT's opinion, right? Don't give somebody 26 exercises when 5 will do.
Right.
And don't give them 5 sheets when, 5 exercises will do.
TMI.
Because there's somebody will look at that and you don't even have the conversation of saying, hey, these are the progressions. This is how, if you're hurting this, or this, they just say, here. Well, that's pretty daunting. They might not even start. So I think that conversation is important too. So, some of that's on, as with everything, some of it's on the provider too. So.
Mm-hmm. Oh, for sure.
Which, back pain being as common as it is, and that's being one of the areas that you kind of hit a lot, I'm sure you see that full spectrum of that kind of presentation. And
yes.
I don't want to touch any sore subjects.
No, you're right. It's just like, yes, you do have to do this forever. You don't have, it's not that much. I can show you like all these things I gave you, all of these things I gave you, or you're going to do 3 times a week, soup to nut, all in 10 minutes.
I was
maybe
just going to say time
15.
requirement. Yeah.
Mm-hmm. So you got, I have a tendency to ask people, how much time are you willing to give me?
Yeah.
How much time a day? How many minutes per week are we talking about here? Because we'll adjust. Mm-hmm. And I think, I think any provider worth their salt is going to do their best to, again, become approachable to their patient. Sure.
But that's a great point, that it doesn't always take maybe as much as some people think, that maybe they're put off by like, oh my God, it's going to be like, 8 hours a week or whatever. It's like, some simple stuff can make a huge difference. It doesn't take that long, but it's the recurring, doing those exercises recurringly over time,
mm-hmm.
Just the consistency more than like total number of hours in.
Oh yeah. The continuum is humongous, right? And, you touched on health span and that kind of stuff. If you want to fully take this to, the degree of which some physicians that are like writing books about how to have great, marginal decades.
Yeah.
That's great. And there's not a single error in it.
Mm-hmm.
But a lot of folks are pretty intimidated by the idea of 8 hours weekly of zone 2 cardio. Right? Would that help them? Of course. It would help me. Yeah. It would help all of us at this table. But they would also benefit a lot from 2 hours a week of zone 2 cardio. That's a big difference, right?
Oh,
you spread that out over
anything greater than 0.
Right. So it's like, just take a walk.
Yeah.
Take a walk with your friend, with your dog. Like, let's make this enjoyable. So.
Right.
Well, and I can't remember how much he wrote about in the Outlive or whatever, but certainly on the podcast, and he's got PTs on staff, that, and huge, because he's had shoulder stuff and things like that, and but I think as that that longevity, obviously he's a longevity expert, that therapy part of it, movement part of it is
crucial,
massive. Like, I think in his opinion, more important than anything else. Like, in his opinion, more important than diet, more important than.
Dale Bredesen, right, with the whole cognitive decline component, really, really, really emphasizes movement.
Yeah.
And PT. Really, it's huge. In his most recent book, there's numerous spots in there where he's talking about movement and how crucial it is. Cognitive decline. Like, who relates that? I don't think I automatically go from Alzheimer's to physical therapy. Like, I do now, in the last couple of years,
as
but
part
it
of that,
wasn't
like cognoscopy. I don't know what
Yes.
name you give for the annual like PT physical or whatever, like the physioscopy or whatever. But part of that whole thing, I mean, that would be, again, that full circle thing of like how functional medicine and what you do, it just dovetails perfectly. And it's part of like, if you really want to see where are you at physically, I think that's a big part of it, because we can do some body composition analysis, and we have some programs that are involving things like that. What's your heart rate recovery, some basic sort of cardiovascular markers, but having some of those movement markers and what are you deficient in from a muscular standpoint, and what are you at risk for because of that. I mean, that is, I think that,
It should be just as important as your colonoscopy and all of it.
Yeah, I mean, you talk about hormone changes, osteoporosis, those sorts of things.
Muscle, yes.
Yes, muscle, weight-bearing exercises. If you're going to boil it down to one thing, like, okay, if you can only do one thing, what should you do? It's probably weight-bearing exercise.
Yep. Well, so now you're speaking my language, right? Because I do a lot of perimenopause, a lot of menopause, and the number one exercise we talk about in here is weightlifting. Mm-hmm. And so yes, we add in zone 2 cardio for sure, because that's life, right? Part of your life is you're walking and doing all these things. And we just try to increase the time and maybe the intensity of that, but it's lifting weights. And so many women are coming from this generation of like Jane Fonda, right? Where it's like all aerobic and no weight bearing. Jazzercise. No, it is. It's a thing. Mm-hmm. And so we have to like reprogram our brain into recognizing how important lifting weights is. Right. And so we have a whole like component in my programming that's all about like lifting.
And so those changes, like, it's not a given. Like, yes, you're more predisposed to having muscle loss. Like, it's called sarcopenia as we age. But,
you don't have to.
If you're getting enough protein, if you're doing the right exercise, you can really mitigate a lot of those losses. And I think it's also interesting the change in connective tissue, like the pre versus post menopause, because I know those hormonal changes can really affect connective tissue.
The connective tissue component gets really surprising, because the sarcopenia you mentioned that's coming, right? To some degree, that's coming. That's that glider we talked about. Yeah. So you get it up as high as you can. Yep. So you're starting your glider at a higher mountain peak, so to speak. But the connective tissue component's the same. You're talking about movement. I mean, we're seeing, my wife teaches the first grade, right? So she's got herself.
She's amazing, by the way.
She's got herself a captive audience of 5 and 6 year olds. Mm-hmm. And you're getting kids, we're pivoting a little bit here, but you're getting kids that are unable to touch across midline, like rotational coordination. I think our people that are coming into this office are getting fitter. They're getting more wise and like educated about what's going to keep them healthy and happy and moving well. But the general consensus continues to go the wrong way. And you can do the screen. We can have the talk about phones. We can have the talk about food. I think we all know that stuff, but it's not going to go away. I mean, capitalism's going to win. Like, we're going to continue to sell cell phones, or we're going to continue to have McDonald's, so that ability to talk to somebody that you trust and have somebody who's perimenopausal and they're scared to death because they got on Instagram, because we all have that.
Oh, yeah.
And they're going to say, like, you're asking me to do what this girl's doing, and they might get like the first one they look up when they say female weightlifting might be, and God bless them, I know they're here, like, but the Baileys, those sort of, I mean, that's not what we're talking about. We're not asking you to go squat 225 pounds. That's not what weight bearing means. No. That's not it.
and that's where I kind of will show up too, and I'll be like, hey, I work full time, I teach, I have 2 kids, I'm married, I like to play and have fun, right? But I still am finding a little bit of time. But I'm not spending 2 hours a day lifting weights.
No.
Right? Like, that's not going to happen. It's not my reality. But how can I get movement into my day? How can I get movement into my week? And so we kind of talk about the realistic components of it.
Yeah. I mean, I have same camp, 2 kids, married, all, etc. Try to shut down at a certain time every day, keep your mental health strong.
Unless I'm texting you about, like, hey, are you ready to talk tomorrow?
But I mean, it's 45 minutes a day that's a solid place to be. And you talked about consistency. Consistency is always going to win.
Yep.
That ability to move, that ability to get to the end range of your joints, how much difference that makes, like maintaining that mobility, that stretch component, how much collagen improvement that, how the connective tissue, secondary shoulder. I mean, we're so dependent on our on our axis, our shoulder blades, our hips, and making sure those things move well so we can move downstream and we don't have, neck pain because your shoulders, you haven't reached up to 180 degrees in 180 months.
When you're looking down at your phone doing this, or a computer doing this.
Well, like that posture they call it, like, just did,
tech
right?
neck.
Yes, when I have kiddos come in for sports physicals, because I still do a lot of those, I'll literally like push their back and shoulders and adjust, and they get 3 inches taller, right? Just by doing that. But then they're also like, oh my gosh, because they're so used to doing this. But adults are too. We're the same way. Like, we're not better.
But if you're raised from a little kid with tech neck
that's where we're at
loss of mobility because of we talked about this, I think, way back, the loss of a lot of the PE programs in schools.
Recess.
Recess. Yeah. I know. We need recess. Recess is huge.
Yeah, we just don't move.
Yeah.
I mean, you watch Little League sports. I mean, I think it's kind of the same vein we talked about with health before. Like, the good are getting better.
Right.
But the average is going down.
The other way.
Totally.
And that's happening with a lot of things. But no, I mean, you talk about posture. We're going full circle with a lot of these things. You do individualize as much. But one thing I tell tons and tons, I mean, an incredibly high number of people that I treat is take a deep breath. Like, really inhale, really fill your lungs. And then as you exhale, just leave your chest there.
Right, stay there. Right.
Just stay there.
That's a good way to do it, yeah.
Just stay there. So breathe in, and then don't move your neck, don't move your chest, and just breathe there.
Yeah.
Stay there for a minute.
Right.
And then do that once an hour. Don't hold your breath.
Yeah.
Just stay there.
Yeah.
Do that once an hour. And those muscles up at the base of your neck, shoulder blade stabilizers, oftentimes people will be like, I'm really sore right there now. And it's like, yeah, those have been on stretch and rotated for a long time.
That's awesome.
I just once an hour, set a reminder on your phone, top of every hour.
We should try to do that for the next little while. And
think about how does that affect your breathing, your lung volume,
and your belly,
all the downstream things from
everything.
there.
Yeah, I'll do that one, and then I just have people do big, dramatic, slow shoulder circular articular rotations, cars.
Okay. So roll your shoulders.
Roll your shoulders, big, like you're going through mud all the way back, stay back, go down. Like, really think about moving your...
Crack.
And you do, because that's that subscapular bursa.
Yeah.
Pop, because you haven't, not you, the
collective
the collective you haven't moved your shoulder blades as much as they move. And,
right. Yeah.
And so just shoulder blade and big breath. There.
It's huge.
So much.
Yeah.
I mean... that the fun part of PT are the ones that the stuff that we talk about on podcasts don't work for.
Yeah.
But so many people get a humongous benefit of just do that.
Right. Start there.
That. Right. Oh man, I don't have a headache. All right.
Yeah.
Now, drink a little water. See how it goes.
Don't you always
put down the Cheetos?
Yep. Don't you guys also do the workplace assessments?
Yeah, that's a whole nother. I mean,
it's ergonomic,
because I'll catch myself, like, I come into this room actually and do visits, and a lot of times I'll be sitting back and forth and I have my computer here, to the side, and I'm like, oh, this is bad, Brittany. I need to because I'm totally jacking my spine trying to
doing one thing, turning your head at a bad weird angle,
and so that's been, we talk about passions. This one
is that a passion?
Yeah. So. Industrial health or workplace health.
Yes.
It's PT. I mean, there's a ton of PTs in Western Montana because we all want to live here. It's like orthopedic surgeons.
Right.
And everybody's going to move there, right?
Yeah, it's amazing.
Right, but everybody does, knees and that sort of stuff. But industrial health, functional health, that's been interesting and fun. I really enjoyed kind of moving into that area as my career's evolved. We call them post-offer screens, post-offer employment testing.
Oh, okay.
So we do that with some companies in the Valley where it's like, hey, this person's been hired. It's not contingent. They've already been hired.
Right, yeah.
To take on this job. And then they come to us and we give them a 30 to 45-minute physical screen based on their job assessment. So we take the job assessment from the employers, like, hey, what do you want to do with this? This is the test that we're developing for you. Do you like it? Yes. It's a huge, it's a upfront cost for that employer, but you're not you're not hiring somebody to then take on their comp claim after that.
Right.
Yeah.
And so
it's smart.
Yeah.
And we've been doing that stuff. We've been doing ergonomics with people at their job
Office,
place.
right, where screen.
Yeah, we've done office
Keyboard.
workers.
Yeah.
I've done mill workers.
I
We've
was gonna
done.
say, I think you guys did the school.
We've done the school.
Yeah,
We've
like-
done masonry
Yeah.
outfits.
Super great.
Our Great Falls location has military
Oh, wow,
involvement.
yeah.
Yeah, so you're working with a
Yeah.
lot of people in that vein.
Mm-hmm.
The cool part about that is people want to go to work. I mean,
Yeah.
contrary to popular belief, people want to go to work. They
Yeah.
do. And so when they know how to work safe and we can say,
Right.
hey, let's just do this little change and keep them happy and healthy and at
Mm-hmm.
work,
Totally.
everybody's better off for that. It's
Yeah.
been
Yeah.
a step in the right direction.
Acting
so.
upstream.
See, I know, again.
Prevent
I
that
know.
downstream loss
Yeah.
of
I
you know
know.
quality of life, loss of work, loss of
Yep.
income, all those things.
All
Yeah,
those
it's a
things.
huge
Yeah.
component of what we can do or what we do.
Right.
Do.
Yeah.
But we do that is there are some industries locally that have really taken advantage of it, and I'd like to think that they've reaped quite a few rewards. We've ran some numbers for them, and just on estimations on what the work comp dollars that they've saved over the last few years
That's awesome.
it's when you
Sells itself.
when
But
you get
also
to the
the
end of the year and do
people.
the math, it's
Yes.
like I find myself checking my own numbers. Like there's no way.
Yeah, that's awesome.
But the benefit to the person, right? To the actual employee that's now not struggling, and they're probably getting some like strengthening, like I'm sure you're
Oh.
giving them exercises and different things.
Stuff to do at home.
Yes, which is fantastic.
Yeah, think
Like,
about this.
reaps the benefits,
Take
yeah.
a deep breath.
Yes, take a deep breath,
just
roll
better
them
worker, more
shoulders.
efficient, more
Yeah.
you know, if you're like uncomfortable or you're
Mm-hmm.
you know doing stuff that's causing you pain, like your efficiency, your quality
It
of
goes
work
down.
is going to go down.
Yeah. So even if you look at it the most cynical way ever, like it's strictly a balance or a line item, it still works in everybody's benefit.
Yeah.
Right. Yeah.
So
Okay, I have to ask one more big question though, because
Yep,
again,
and
you
we're
know,
hitting
I
our-
do
We're hitting our
hormone.
yappy time.
Oh, we
so,
are.
Yeah,
we get so yappy. But
right.
you know the hormone piece, right? Okay, so we have estrogen receptors everywhere. One of the biggest things perimenopause, people are coming in right with shoulder pain, hip pain, right? So I am always like, oh, well, we have a hormonal component here, but oh my gosh, physical therapy is such a great option. Like, what do you say with that? What do you like? Are you like, yes, send us those people,
without
or
a-
no, don't? What do you? Give me your thoughts.
without a doubt. I mean,
Okay.
so I think I was mentioning too how axial we are.
Yes.
I mean, we treat spine, we treat shoulder, we treat hip,
Yeah.
and everything is. I'm oversimplifying. I can hear the PTs on the other side of this yelling at me, but I really try to like set up systems in my mind, like how you're really kind of treating those three things. And anything is going to be a lot of shoulder if it's upper extremity, neck, head, lower extremity, low back, you're going to get hips. So your axial skeleton, your proximal part of your body is what you really start working on. It's where the stability comes from. So you can have proximal stability, distal mobility. That's what we work on. Bursitis, so much of that is, I mean, the hormonal component is one thing, but if you're looking at things like bursitis or
Yeah.
glute tendonitis,
Yeah.
small exercises, things that take a minute or two, once a
Right.
day, while you're brushing your teeth, sort of things, like they can just make huge differences.
Yeah.
I like what I'll tell people, they come in lateral hip pain back
Yep,
here, like,
been there.
it's right in my joint.
Been there.
It's right in my joint. And it's like, okay, so
No,
that's not in your
quite
joint,
Yeah.
and here's why you're in the right office.
Yes.
So that's always kind of a fun talk. Like, okay, that's where it hurts. Doesn't hurt here. You do all the tests. Okay, if you had hip arthritis, when I did this to you, you'd have punched me in the face.
Yeah.
You didn't.
Yeah.
So we're probably in the right office. That's a
Yeah.
good sign. Like you want, like.
Yeah.
Yes.
So we start working, and then people they don't want to come in because like, oh, I'm so weak. Good.
That's where we get strong.
If you came in and you
Yeah.
had this pain and you were strong everywhere and mobile everywhere,
Like, what the heck
I
else
don't.
is
We don't
that?
have anything to do. Like the
Right.
deficit is what gets us excited. That's the
Yeah.
all right. There's something that's good. That's what we're
Yes.
going to work on.
See, there you go.
So,
That's awesome.
Yeah.
That is awesome.
So how do people find you?
Yeah.
oh goodness. I mean, the quickest and easiest way for everybody is OrthoRehab.com. Right.
Yeah.
We have again 12 locations across Western Montana. We have a toll-free number. 844-406-ORPT.
Nice.
So we got that you'll get somebody that'll direct you to whatever location you want.
And do we have a link on our website to
We
theirs?
do, actually.
Okay, yeah.
We link directly to your guys' website from our website. So if you go
Awesome.
to functionalmedicassociates.com.
Associates.com.
Yeah.
Where are we? Who are we?
I know, right?
But yeah, we're hopefully close to you, and hopefully if you're getting this in a town that doesn't have an OrthoRehab yet in Montana, we'll be there in the next few years.
Yeah, no kidding. Awesome. Well, thank you so much, Tyler, for joining our podcast. Yeah.
Pleasure, guys.
Fits in. So again, if you like this podcast, please share it, like it, send us comments, and or if you have any ideas for future podcast episodes, forward that as well. Mm-hmm. Again, Tyler shared their contact info, so highly recommend getting it, at the very least, do your annual PT physical, because it could save you a lot of heartache and pain down the line.
Yep.
And we'll be back with the next episode in a couple weeks. So thanks for listening.
Yeah, thanks for having me on, you guys. You guys are doing really cool stuff. It's much appreciated.
Awesome. Thanks for coming.
Thank you.
All right. Take care.